So, greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I'm very, very pleased to welcome Nai Awkar. Nai comes to us out of Lebanon. She is a registered nurse. She has a Bachelor of Science in Nursing and a Master's in Pharmaceutical Development and Management from the Lebanese American University. And she says her experience ranges from hospital bedside care and healthcare coaching for chronic illnesses to researcher in the community. She's a faculty instructor at the Lebanese American University School of Nursing, is passionate about caring for the community, and she participates in several health campaigns and activities. She's also an editor of a local journal, the Panorama of Emergency Medicine. So, Nai, welcome, welcome.
Thank you. Thank you so much for having me.
It is my great pleasure. And look at that with your bio, and you wear so many hats. You do so much.
Yeah. I don't know how I make it happen.
And that's the thing. If you really want to make something happen, you'll find the time to do it.
Yeah, true,
Yeah.
true.
But what started you on this journey? What started you on this journey? How did you come to be a nurse?
Basically, I have my two older sisters. They are also nurses.
Ah,
So they encouraged me to pursue also a nursing career. They taught me how to be passionate and caring, and that nursing is also a message. It's not just a job that you do, it's a message that you carry on, you carry forward to the generation, to the older generation, to the young, to everyone that you meet.
mhm.
So I was inspired and I decided to be like them and I wanted to do nursing as well. So that's how it all started. Yeah. And nursing school is really difficult and if you do not have the right support, yeah, you cannot make it. And my sisters, they have been a great support throughout the years and that's what inspired me to become a nurse.
Mhm. So that's great. I was about to ask you that in spite of the fact that you had this support, what were the challenges for you particularly?
Basically, I think waking up very early was a great challenge for me, especially that I attended high school and my high school started at 1 p.m. So I didn't have to wake up early for high school and then university life after 3 years of high
Mhm.
school. I started waking up at 5 a.m. and 6 a.m. It was very frustrating at first. I thought that I cannot do this again, but each day I would still wake up at 5 a.m. and I would go to my clinicals.
Mhm. Yeah, yeah, I understand that. It takes a bit of an adjustment, even if you didn't have that shift in your body cycle, it's still an adjustment.
Exactly, it was suddenly.
Yeah. So you worked in different areas and you've been a nurse since 2018. What would you like to see done differently or change?
Um, in the case of Lebanon specifically, because I only practice nursing in Lebanon, I would really like to see the shortage of nursing somehow solved, or because nurses are overwhelmed here. The ratio to one nurse to patients is huge. Sometimes it's one nurse to seven patients, eight patients, and it's a lot, and it also creates an area for error. Nurses are human beings at the end of the day. They are not robots. They cannot work precisely, exactly. So if they are tired or stressed out, they might be prone to errors. This is what I like to see differently here.
Yeah, I don't know how we're going to fix this. As I speak to nurses anywhere in the world, I'm hearing the very same thing that nurses are overwhelmed and staff to patient ratio or patient to staff ratio is high, unconscionably so.
Yeah.
Um, And I am not sure how we're going to fix it. How do you think, speaking of how we're going to fix it, then, do you think that this explosion of technology that we're seeing in healthcare could assist us in that?
Yeah, I really believe so. I mean, not the direct nursing care, but maybe like if you have a small robot carrying the medication with you, carrying the necessity things, so it might lift a little bit of the nurse's work. You don't have to carry all the things with you across the patient rooms, for example, or maybe inside the patient's room. This small robot can help you, assist you, giving you utensils or anything
Mhm,
that you need.
yeah. I foresee that somehow or other we're going to have to resort to that kind of thing because, um, or I don't know if it's resorting or evolving, but we cannot continue this feeling overwhelmed, not feeling, being overwhelmed.
Being overwhelmed,
Um,
yeah.
it's not sustainable. It's not
True.
sustainable at all. So, as a clinical instructor, is there any particular, do you think that we are adequately, not just in Lebanon, well, let's speak to Lebanon because that's what you know, but do you think that we're adequately preparing nurses for the next 10 years?
Um, yes and no at the same time because the technology is always evolving and we do not have that kind of technology given in courses. We teach our students how to critically think, how to, evolve their minds, keep up to date with any new technologies or findings in the health field, but we don't exactly like teach them how to use technology or AI, for instance. We do not integrate it in the curriculum. I hope it will be because it's very helpful. But for now, once they graduate, they are basically on their own. They have to do their own research if they are willing to. Sometimes they do not find the time to do so. So it is actually better if it was integrated in the curriculum.
Yeah, yeah. I kind of I think so because, as we were just saying, it's going to be part of how you function day after day. So we might as well be prepared for it on all levels or embrace it even more than be prepared. We need to embrace it, I think. I think. So you you say you're very passionate about coaching for chronic illnesses. This is something that I zeroed in on this because this is something that's one of my passions as well. Many of the
Yeah.
chronic illnesses that our communities across the globe experience, not really necessary for them to experience. But how do we prevent them getting to that place? So what do you do?
When I was a coach, I had patients diagnosed with psoriasis. And as you know, psoriasis is a chronic illness and it is not very well understood. So patients, they feel ashamed of themselves.
Yeah.
They do not go out in public, do not wear revealing clothes, wear hats, especially if they have on their head psoriasis there. Basically, I just hope that through our encouragement, awareness, and support, they come to accept themselves. And we just know that the goal for their treatment is just to relieve the symptoms and make them feel better, have a better life, better outcomes in their treatment, in their careers. So just to feel basically good about themselves again.
But is that feeling of wanting to hide these things, um, is that because there is great stigma? I understand that, this business of not liking the way it looks on you, regardless of what the community situation is like, but is it stigmatized a lot?
Yeah, it is, especially that the community is not aware of what the
That,
disease is. There's little knowledge. They think that they might get the disease just by touching it or basically by looking at it. They are afraid to catch it.
yeah, yeah, I
So
can
they
see
think
that.
it's a contagious. Yeah,
Yeah, which would make it really difficult, makes your job of making the person feel good about themselves really difficult.
exactly. Yes, because how can you tell them that it's okay to show them that they are fine, this is not contagious, when everyone around them is afraid of them?
Yeah, exactly. I can see that. I can understand that. I can understand that. Are you seeing it's shifting straying a little bit perhaps, but are you seeing a rise in, as you talk about chronic illnesses, other chronic non-communicable diseases like diabetes, hypertension, obesity, that kind of thing?
Yeah, yes, especially now during these times.
Hmm.
Sometimes stress or whatever you are going through, they trigger the development
Yes.
of diabetes, the hypertension. So yeah, we are seeing it a lot,
Hmm.
especially now in the refugee camps that we have.
Yeah, yeah, I can imagine so. I can imagine so. Wow. So you're also an editor of a local journal, Panorama of Emergency Medicine. And in addition to being an editor, you're a researcher. So what drew you to that particular niche?
Um, uh, I started my research journey after I graduated. I got a call from my instructor. She said that she has a research and she got funding for it for diabetes outcomes and the environment for diabetic patients type 2. If I am willing to join her as a nurse researcher, basically she wanted me to do interviews and collect the blood from the patients to test their blood levels and the HbA1c. So I said, okay, I will join. She said it's a part-time job based on your availability, and of course, you're gonna be paid for it. So it
Hmm.
wasn't something I volunteered for. So I was like, sure, I can use the extra money, and I have the time. I went on it. We went to primary healthcare centers. We interviewed diabetic patients, took their blood. I actually had a good time during my interviews and how to connect with these patients. It was something nice. I enjoyed it. So I decided, since I have the time, I can also pursue something in research. And it happened to be while I was doing my master's in pharmaceutical development and management. And it gave me the idea to do a research on diabetes outcomes in male rats, not humans now, animals. So I used the animal model. I induced
Hmm.
the diabetes too, and I gave them a treatment of cannabidiol to
Yeah.
see if it's effective on diabetes. And I did this research. I published it. It was my master thesis topic. Yeah. And after that, I gained this experience in research. So I decided to apply for an editor job in Panorama of Emergency Medicine. And I got the job, and that's how I got this extra hat.
But look at how one thing leads to another, one experience leads to another. And that is something that's so typical. I don't know if it's unique, but it's certainly typical of nursing. Is that it exposes you, you try one thing and it exposes you to 10 other things almost simultaneously.
True. That's what I tell my students. I tell them, you're not limited just to bedside care. Nursing world is an open world. It's very big. It has different roles in it. You can be whatever you want. And the sky is basically really the limit to nursing.
Yeah, yeah, yeah. I don't even know at this point if there is a sky to be the limit because every time I think that I know where we can go, it turns out that we can go further than that still.
Yeah, true, true.
Yeah. So, well, I think you just answered one of the questions I wanted to ask. I was going to ask you, what advice would you give somebody who wants to be a nurse? Oh, seriously, what advice would you give them though?
I would give them an advice of always being courageous and not to be afraid of the unknown. Because even if you do not know, for example, what coaching means or a researcher means, you just go on that adventure and you will find out if you like it or not.
Yeah. Yeah, yeah. And I'm happy you described it as an adventure because that it is.
Me too.
Yeah.
Yes.
What do you do though? We're talking a lot these days about how nurses, one of the things you brought up was the nurse to patient ratio, which of course leads down the road to nurse being overwhelmed, overburdened, overworked, all of those kinds of things. And which makes it imperative that we pay attention to ourselves. So what do you do to care for you?
Um, Basically, I go to the gym. I have a class given at my gym. It's called U-Bound. I don't know if you know about it. It's a trampoline, and you jump on a rhythm due to music on a trampoline. It's very stress-free. It relieves you of all the stress. It renews your energy. So this is this is what I do to regain my strength at the end of the day.
It's a big thing. It's a big thing. As you were talking about it, I could just to myself, because then that is the kind of thing that brings screams out of you and all of that.
True. Yes.
If you could tell me in one word what you think of as the most essential quality of a nurse, what would that word be?
The most essential quality of a nurse, I
Mhm.
think, to be attentive to details. It is very, very important to know all the details of your patients. If you find something that is very small changes, you have to notify the physician, as it could be something very, very big and has a big impact on the patient's health.
Yeah, yeah. And that's one of the things about nurses. Our education, our experience and whatever, um, almost forces you to pay attention to detail. You pay
Very true.
attention to the micro at the same time that you're paying attention to the macro, the whole um, picture. You absorb the picture almost
Really true.
immediately.
Yes. And it
Yeah,
also makes you a good listener. Like you have to listen to what they are telling you, because somewhere they might tell you what led to this complication, what drug did they take, for example. So also a good listener is a skill that you gain in your nursing career.
absolutely, absolutely. And it is one that opens us up to one of those other, avenues that we talk about so much. So now, before we go, is there any last word you'd like to leave us with?
I would basically thank you so much for your time, and especially for considering my profile. I really did not think it was this important, but after you contacted me last year, I felt really special. And then you contact me again because I wasn't available at that
Yeah.
time. I felt like, wow, my profile really seems to be interesting and attractive. I did not think of myself as someone who is worthy of an interview, or my career is a good accomplishment, but it gave me really a sense of accomplishment, and it made me feel good about myself, and that I am must be doing something right to be on your channel.
Well, thank you so much for saying that because that actually embodies one of the questions that I usually ask nurses is what do they see as their greatest accomplishment so far? And I usually use so far because we always have something else to do. But I am glad that you said that because that's one of the things that I really want us to pay attention to is the fact that we're doing stuff. Sometimes we get so involved in the work of what we're doing that we don't take a moment, or we don't even have the time or realize that we have done a lot very often in a very short time. And we need to give ourselves the credit for it. So I'm glad you brought it up.
Yes, thank you. Thank you for reminding me that I did good so
Yes,
far.
you did. Yes, you did. Thank you so very, very much, Nai, for this conversation. Let's stay in touch.
Yeah. Thank you. Yes, of course we will.